So I wanted to ask you a conceptual question just about the individual market. Do you think that health insurance should be priced like car insurance based on a person's risk? Or do you think it should be priced and marketed like a social benefit where we're all in this together?
You know, I think health insurance is deeply personal because health care is deeply personal. And in an auto insurance market, you, for the most part, can control your behavior. You can follow the rules of the road. You cannot be distracted on your devices or with additives in your system. You can make those changes. With healthcare, you just wake up one morning, your doctor says, I got bad news. You've got breast cancer, or you've got this problem or that problem. And so it is a different market in that respect. And the question, I think, is how do you get an insurance product that they can afford? Now, states have experimented in this with what the bad term is high-risk pool, but basically Maine has had an interesting idea we tried to look at, where they have an indivisible high-risk pool, it comes in behind, and just takes that group that is so costly but small numbers, takes that high cost and socializes it back here. So your rates never really reflect the fact that you got some bad health issue. I also think you can incent people to take care of themselves better too. But you should recognize that.
You think that Americans have reached a point where their view of health insurance is that it should be more like a social benefit where everyone pays for everybody?
Well, I would tell you, I've done 17 town halls in my district. I think I'm second only to my U.S. Senator in the entire Congress in town halls. And for the people that turned out at those, and they were very energized, shall we say, when I asked the question, how many favor a single-payer government-run health system, the audience went wild. You see this alternative playing out in California right now with their estimated $400 billion government-run, no private sector insurance concept that would result in a 15% payroll tax, among other things. And that's just their estimate, which is probably pretty rosy. This is why we have a moment here to try and get in and fix this market. I would argue to you that if we don't, the odds are we're going to move to a more government-run system. Now, some may embrace that, but we have those systems today. And I would tell you, like in the VA system for veterans, I'll bet every single member of Congress has one or two staff persons that's like I do, that spend all day, every day, trying to help our veterans get access to the care they're being denied. So I'm not sure that's the system we want to go.
And we've certainly heard that Senate Majority Leader Mitch McConnell has warned his members that essentially if they don't get together and get something sorted out this fall, they could be looking at single payer, which is potentially a little bit of a stretch, but certainly something that Republicans are arguing right now is the alternative.
Well, you always look at the field and say what's out there and what's coming. And I would tell you, because it's so intensely personal and there's so much energy behind it, led by people like Bernie Sanders and others, that there are a lot of folks who just soon have the government take care of this, whoever the government is. But by the way, our other health care programs are suffering, and funding them is a problem, and. And
do you think that businesses could support a health care law that resulted in fewer people being uninsured, even if they're uninsured by their own choice?
Yeah. So we should talk about that for a minute, because CBO's, again, off by a 2-to-1 ratio. Yesterday, the data came out from HHS, Health and Human Services, about how many people were enrolled in the Obamacare exchange versus how many the Congressional Budget Office predicted would be enrolled in 2016 and 2017. And in each of those 2 years, the Congressional Budget Office estimate of who would be signed up was off on a 2-to-1 ratio, 2-to-1 ratio. So they've got a tough job to do, but their data points haven't been precise. I would imagine if, as CFOs, you were off by 2-to-1 consistently in your predictions, you might have come to the CEO meeting. CBO has been off 2-to-1. Of those who signed up and then left the Obamacare exchange within 1 year, 46% cited high costs, which gets me back to the other point, which is we've got to address this high cost issue.
So if you bring down health insurance premiums, even if it's voluntary to buy health insurance, again, you think that people will still buy it in the same amount, in the same numbers that they did?
We'll see. I mean, it is their choice, but they're making that choice today. And in fact, they so reject the product at hand, they'll pay the IRS whatever the penalty is in their world, so they don't buy the insurance, or they get a hardship waiver. About half of those who don't get insurance. About half pay the IRS a penalty. I mean, can you imagine your product in whatever your company you're in, that people would rather send a check to the IRS than buy your product? I mean, that's what, or service?